Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 5 NCLEX questions. Without delay, let's get started.
The nurse is caring for a prima gravida client in active labor who has had 2 fetal blood samplings to check for fetal hypoxia. The nurse determines that the fetus is showing signs of acidosis when the scalp blood pH is below which of the following? 1. 7.5 2. 7.4 3. 7.3 4. 7.2 The correct answer is 4. If the fetus is hypoxic, the pH will fall below 7.2 and be indicative of fetal distress. Crisis intervention plays a major role in the management of care for clients with chronic mental illnesses. Although the safety of the client and others is always a priority, these clients typically need crisis intervention in which of the following situations? Select all that apply. 1. Inability to keep outpatient appointments. 2. Signs of relapse and decompensation. 3. Threat of eviction from housing. 4. Unpaid bills and lack of food. 5. Occasionally missing a dose of medication. The correct answers are 2, 3, and 4. Although all of the situations require immediate attention, the inability to keep outpatient appointments is less critical than signs of relapse and decompensation, threat of eviction, and unpaid bills and lack of food. A 69-year-old client is admitted and diagnosed with delirium. Later in the day, he tries to get out of the locked unit. He yells, "Unlock this door. I've got to go see my doctor. I just can't miss my monthly Friday appointment." Which of the following responses by the nurse is most appropriate? 1. Please come away from the door. I'll show you your room. 2. It's Tuesday and you're in the hospital. I'm a nurse. 3. The door is locked to keep you from getting lost. 4. I want you to come eat your lunch before you go to the doctor. The correct answer is 2. Loss of orientation, especially for time and place, is common in delirium. The nurse should orient the client by telling him the time, date, place, and who the client is with. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at AlphaNurseGuide.com. Back to the questions. Which of the following is a realistic short-term goal to be accomplished in 2 to 3 days for a client with delirium? 1. Explain the experience of having delirium. 2. Resume a normal sleep-wake cycle. 3. Regain orientation to time and place. 4. Establish normal bowel and bladder function. The correct answer is 3. In approximately 2 to 3 days, the client should be able to regain orientation and thus become oriented to time and place. The nurse has placed the intubated client with acute respiratory distress syndrome in prone position for 30 minutes. Which of the following would require the nurse to discontinue prone positioning and return the client to the supine position? Select all that apply. 1. The family is coming in to visit. 2. The client has increased secretions requiring frequent suctioning. 3. The SpO2 and PO2 have decreased. 4. The client is tachycardic with drop in blood pressure. 5. The face has increased skin breakdown and edema. The correct answers are 3, 4, and 5. The prone position is used to improve oxygenation, ventilation, and perfusion. The importance of placing clients with ARDS in prone positioning should be explained to the family. The positioning allows for mobilization of secretions, and the nurse can provide suctioning. Clinical judgment must be used to determine the length of time in the prone position. If the client's hemodynamic status, oxygenation, or skin is compromised, the client should be returned to the supine position for evaluation. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at AlphaNurseGuide.com.